My name is Sydenia Rios. I'm an LPN. I was a CNA before I became a nurse for 15 years. And I love the one-on-one connection that I had with all my patients and residents. And I feel like home health is more of that than if I worked in a facility or a hospital or whatever. I get more of a one-on-one connection. I actually started with the Spring Hill office, and then I eventually switched over because I switched to the Volusia County office. I love care options for kids. I love, the fact that if I call, I always get a response. If I need something, someone's always there. The DONs, the nurses, other nurses, it's always consistent. I've never had a problem. Even with the Spring Hill office, they're great. I like to have continuity of care, so I like to stay with someone as long as I possibly can. I came upon Athena. I know that there are nurses that are made for the emergency room. They like the adrenaline high, they like that. But I love home health, and I would recommend it to anyone because whether you think about it or not, we are our own backup. It's not so much about the title. It's about being in the present and taking care of whoever you're taking care of, whether it be a child, a geriatric patient, whoever it is. In the home, you form a special bond. And I think that really is unbreakable. It's good for new nurses to be able to come in and do a meet and greet, because sometimes our patients, when we look at the clinical side and on paper and their history, it can be kind of intimidating. But then once you get in here and you see the actual client and, see how different maybe they became from the original state and their baseline at home, maybe that will help you to know it's a good match. So I think it's important for each nurse to fit the family, not just the patient or the client, but the family in general, because it's their house, it's their home.